Hello again. Welcome to Bold Influence with Lyna Nyamwaya. Thank you for joining us. I see a few people joining in. I want to welcome you all for choosing to spend your few minutes with us. Your time is clearly a gift to me. I thank God for this opportunity. I thank God for life, especially a time like now. And tonight we have an exciting show. Very exciting. I am going to bring you two bold leaders. Hi, Miss Valentine. I see you. Hey, thank you for joining us. Don't do that, Baba. I want to welcome everybody that has come on and invite my guests today. And I'm going to invite them in an order that they are joining us. Hi, thank you. I can't see who's commenting, but our viewers from YouTube, our viewers from Facebook, all our viewers that are watching us from different walls, I hope that James is shared on his wall and Miss Adrienne on her wall as well. So we want to welcome everybody that is joining us. So without saying too much, I am going to bring faces so that they can hear me what I'm going to be talking about. So first of all, James and Adrienne, thank you both for saying yes to the invite to join us on this show and educate our communities and, of course, share what you have been doing and what you're doing to stay safe. Having said that, we've been hearing that we are going through the same pandemic. And I like to add differently, because if you're in poverty, if you're a different race, if you're in a different socioeconomic system, clearly you're not going through the pandemic together with everybody. You're going through the same pandemic, however, just differently. And then I would like to start without wasting anybody's time. Thank you for all of you that are joining us. And as you join on, please comment. If I don't see your comments, please forgive me. But I want to say shout out to Karokina, Valentine, and everybody. So James, Adrienne, here with me this evening. And I like to say that nothing takes God by accident. But I think I like to know what is the divine assignment that they're here tonight. And that's part of the assignment that they're here on earth. So I will start with ladies first. Miss Adrienne, to my far left or right.
Hello, everyone.
There's a quorum that is here that want to know who you are. And James, when I come to you, you can say hello as well. So I will read who Adrienne is. And I thank God for this bold because it's made me connected to a lot of new relationships. Adriene Thornton, I don't know if I said that right, has been a registered nurse for 30 years. So first of all, we are connected. She's an RN. So that's my world. Her professional career started in her home state of Georgia. She has worked at children's hospitals and clinics of Minnesota for 23 years. Wow. With 16 of those, she has been as an infection preventionist.
Yeah.
So today, all of you are going to learn something about infection preventionist. In her role, she has been instrumental in establishing Children's an award-winning organization in the field of infection prevention. And right now with Corona, you got a lot to teach us. She has also played a key role in assisting with management of multiple diseases outbreaks, including measles, Ebola, and H1N1 influenza. She currently serves as the past president of the Minnesota chapter of Association for Professionals in Infection Prevention and Control, is a member of the Education Committee of APIC National, and is a content reviewer of the American Journal of Infection Control. In addition to her local and national professional endeavors, Ms. Adriene has also worked with the Children's Heart Link and provide education and guidance on the international level to hospitals in Brazil and India. Shows she's another global citizen in my world. Adriene has a bachelor's degree in nursing from Albany State in Georgia and a master's degree from Concordia University in management in St. Paul, and her certificate in certification in infection prevention and control. And at the end, you're going to tell us how you got all those certifications and qualifications. Maybe that's what somebody needs to end up at Children's.
Yeah. I'm excited to be here today.
Yes.
It's evening now. I keep forgetting it's nighttime now.
It is nighttime. And I'm going to go on and introduce our next guest, James Burroughs. And I always kill his name, Mr. James. He's, I want to brag on James for a minute. James was the first inclusion officer of the state of Minnesota by the past governor, Mark Dayton. And that's how actually we met. James was also our keynote speaker on the gala 2 years ago for the African Nurses Network, where I happen to be the president. So that is how we connected with James. So I like to brag and say there are so many opportunities from many different fields. When he was going to law school, he did not know he would be keynoting the African Nurses Network as the chief inclusion officer of the state of Minnesota, especially at first. So I like to brag on that. And now I will read his bio real quick. He's the Chief Equity and Inclusion Officer of Children's of Minnesota, the big hospitals in Minneapolis and St. Paul. This is a newly created position of Children's and designed to help the nation's 7th largest pediatric health system advance equity and inclusion in all parts of the organization. This includes delivering equitable, quality care for patients and their families, fostering a culture of inclusion, very important to me, in which all employees can be their full selves, and ensuring that the community members from all walks of life feel like valued partners. James has led many quality initiatives and patient quality, employee recruitment and retention strategies, and organizational culture. His work focuses on increasing financial investment and spend with diverse businesses and supporting initiatives that address the social determinants of healthcare. And that's why he's such a big deal in our communities, especially when children need to listen to the patient population that comes there. So people need to know how to be valued when they get, children need to know how to value the customers when they get there. James has more than 25 years of experience in the nonprofit management world, equity, diversity, inclusion, as well as employment law. For those nurses who are being forced to work, you better inbox James. Those nurses in the nursing homes who are being told you better show up, I got you a link. He has an extensive background in developing workplace equity, diversity, and inclusion training, and creating policies and procedures that promote hiring and retention of employees of color, and forging a robust partnership with communities of color and diverse demographics. And my favorite, he served as the first Chief Inclusion Officer of the state of Minnesota under Governor Mark Dayton, and he began a career as an attorney and a faculty, actually, at Hamline. I didn't know that. You might know some people I know. He practiced law at the United States Office of the Federal Defender and Dorsey and Whitney Company. He also has a background in education, holding leadership roles at the Summit Academy and the Chief Operating Officer and General Counsel, as well as the Minneapolis Public Schools and Executive Director of the Office of Equity and Inclusion. Anyway, you can hear everything about diversity and inclusion, and I think that's where we need to focus on. So for tonight, we want to expound on Corona and the racial disparities, whether they're in healthcare, education, immigration, or criminal justice, how they've been basically highlighted and exposed to be seen. I like to say again that they were there prior to this, they are there going through this, and possibly will be there after this. The point is, how are we addressing them, and what are we going to do about them? Are we going to continue to be in those spaces? So who is James, and how did you end up here?
Well, thank you for the robust introduction, I must say. I'm going to shorten that next time, so I won't read it all. But
That's
how
okay.
how did I end up here? I ended up in Minnesota by chance. I went to law school after living in and growing up in Detroit, Michigan. Went to Atlanta to Morehouse College for undergrad, and then also Georgetown Law for law school. And then came here basically to stay for 2 years, work for a judge, and hang out with my college roommate who was here and my law school roommate who was coming with me, and just stayed. So 28 years later, I'm here and got in this work from law because our people, people of color, Native Americans, need a person like me. It doesn't have to be me, but they need an advocate to make sure that Minnesota is more inclusive. Minnesota is not only diverse, but it keeps that diversity by promoting, retaining people in employment, but also too ending some of these heinous disparities that are ridiculous for a state as rich as ours in wealth and also resources to have. So that's how I got here. I'm excited to be here. And before I forget, I want to say a shout out to all the 2020 graduates
Exactly.
this year. I know my president, Barack Obama, is speaking at a high school graduation that's online now. So if you're watching us, I'm even more impressed because you're not seeing out on President Obama, but you can catch him later on the rerun. So
Right?
congratulations to all the 2020 high school grads and college grads as well.
I like that. Yes. And thank you for saying that. And congratulations to all the graduates. I know I missed my speech and you challenged me to record it. So you should be seeing it going online and maybe to the university website. And Miss Adrienne, thank you and welcome. Your
Thanks.
journey into nursing and into the children's. How did you get here?
Oh, it was a short journey. I worked in pediatric home care in Atlanta, and I brought a patient here for to get a second opinion at Children's,
Ah,
and I stayed in St. Paul for a week and fell in love with it. And 6 months later, I packed up my car and my kid and moved up here. And 22, 23, 4 years later, I'm still here. So
wow. You
yeah.
gotta share some tips that children's must have been so drawing that they drew you that much. Within a week you had made a decision.
They did. One of the things I noticed when I was in Atlanta is, I love reading studies. And back then, a lot of the studies that were being published were actually coming out of Minnesota.
Ah,
And so I thought, well, I want to be where the action is happening, where they're creating the science and they're looking at it and they're talking about it. And that was really what, aside from Prince, because I love Prince too. And he said there were no roaches in Minnesota. So I thought, well, it's got to be a great place. But, looking at the opportunities here in Minnesota as a nurse, I just felt like they were really good in Minnesota. And I thought I had nothing to lose to try and capitalize on those opportunities. And here I am. I'm still here. I don't plan to go anywhere.
wow.
Yeah.
I like that. I like that. So getting to where the viewers want to hear about the advocacy work that you do and why we're here as far as how we are addressing corona. So that and maybe James mentioned that he grew up in Detroit and ended up studying in Morehouse in Georgia, and now we're in Minnesota. So Minnesota numbers are up there. They are reflecting that the COVID cases that are known are 14,000, getting to 15,000 by tomorrow. And then we have had about 700 deaths as of today. And now in Michigan, I think there's 50,000 cases, and then we've had about 4,800 deaths. Unfortunately, Georgia, the same thing, 36,000 cases known and 1,500 plus deaths. And I want to say those three because they kind of touch on three of us, because it's Minnesota, it's Georgia, and then it's Michigan. But also to just kind of highlight the numbers that we talk about racial disparities and how then you guys can kind of expound on that. The population of Black people in Michigan, the general population is 14%. They make 14% of the public population. But the cases of the corona, 33% are Black. So they are representing 33%, even though they are half that population. Same thing in Georgia. They make up 16% of the population, but 31% of the cases, even the 30-some thousand, it's Black people. In Minnesota, they've talked about healthcare workers. Jan kind of had good numbers on that. the commissioner, the Minnesota Department of Health Commissioner Jan Malcolm, cited that 1,300 healthcare workers have been affected, and out of the healthcare workers, 74% are white, but only 38% are infected. 19% Black people make up that healthcare worker population, yet 43% of the cases. Latinos are 5% and 6% have been infected. What is your take, and who wants to address it first?
Well, I'll take a first stab. I've been looking at this data for the past few weeks. And so one of the things that we know is that if you have any kind of health condition, so diabetes, high blood pressure, any kind of heart disease, that predisposes you to being sicker and having more complications related to COVID. And we know that our Black and Brown populations are disproportionately impacted by having these diseases. So we know that there are more Black people with hypertension. We know that there is more diabetes in the Latin community, Latino community. We already know these things. And so we know that they are going to be disproportionately affected by COVID because of what happens when you get it. You get the blood clots, you have the issues with your respiratory system. And if you already have a stressed out heart or a stressed out body system from hypertension, you're not able to fight off the COVID virus as well as others. And I think that may be why children do so well, because they tend to not have those diseases that predispose you to other complications. And so in our Black and Brown populations, the health disparities were there before COVID. They're going to be there after, but this does shine a huge light on them because we make up such a small part of the population, but we have such large numbers when it comes to death and numbers of disease for the COVID.
Yes.
And it's disheartening, but hopefully the one thing that will come out of the increased testing is that it will be more equitable. So we're able to just test whomever wants to be tested. Then we don't have people being turned away at their doctor's office because they may or may not have the symptoms that the doctors are looking for, because we're learning more and more about the symptoms that people have when they develop COVID, and it's kind of all over the board. It's the list is quite long at this point, and unfortunately, you don't have one or the other. You could have this one plus another one. You could have none of them. And so looking at symptomatology and deciding to test based on that really has gone to it's not a good way to look at it. So the more testing we're able to do, the more equitable care we'll be able to provide for our Black and Brown populations.
Mm-hmm.
So I'll let James comment, and then I have a question for him, actually.
Okay. Sure. So just to add, Adrienne did a great job of talking about that. I also want to add to talk about those comorbidities that she mentioned, like high blood pressure, diabetes, and asthma. They didn't come about because the Black community did anything to themselves to make this happen. Right. I want to talk about some of the structural racism things that happened to us in this country that led to those things. So one of them is things like racial segregation, discrimination. People were not allowed to have access to housing, healthcare, well-paying jobs, and were forced into communities that we called them ghettos back in the day, forcibly into those places because they weren't allowed to buy homes in other places because of redlining, not getting loans in different communities, because of racial covenants that I know the University of Minnesota has done a study on about. In the housing deeds itself, you weren't allowed to sell to people who weren't white as well. In addition to that, things like asthma and other diseases can be controlled by visits to the doctor. We have a lot of bias and discrimination that goes on in the healthcare system. And I'll be honest, I'm not pointing fingers at anybody else without pointing fingers to children's first. We need to work on our biases as well, because if you come to a system that's not treating you fairly, you don't feel like you're welcome, you're not going to come to the doctor unless you're sick. You're not going to come to the doctor for well child checks as we want to do. So those biases, and also too, things like food deserts. You can go miles and miles without finding many grocery stores in North Minneapolis or South Minneapolis or near our native communities in the Phillips neighborhood. Why is that? It's not accidental, it's intentional. So if you want us to eat healthy, you have to get access to fresh foods, fresh fruits, vegetables, and those kind of things. So I want to make sure that that's clear. We're not blaming a community. We're saying basically those things exist because of that structural racism. The other thing I'll add to that, Adrienne did a good point, is these things are having a negative impact on our community, not only from a physiological standpoint, but from a social standpoint as well. So a lot of the people who are being laid off, and we have one of the highest layoffs in the country, are now impacted negatively by that. I think the data I looked at a couple of weeks ago was the Black unemployment rate was 6% last year. It's up to 26%, going on 30% now. And also, too, the same in the Latino community, same in the Asian community. And also, too, a lot of the essential workers that you talked about that are forced to go into work at the grocery stores, at the drugstores, I'm appreciative of. A lot of those are us that look like that are people of color. And the other thing is, too, we don't have enough access to things that protect us as well. We'll talk about it later, but about PPE and protective masks, hand sanitizer, making sure that if we got to take the bus or transportation to work, that we can be safe from COVID going to work and to and fro as well. So I'll stop talking there, but those are some of the things that come to mind when we talk about COVID-19.
No, that's really good. And I think you need to continue talking because it's important to explain the subject that we are talking. Anybody can pull the numbers from the CDC or the National Institute or the Minnesota Department of Health, or even just any local papers that are reporting on those numbers. Numbers are available, but it's nice to get the context of how we arrived at those numbers. And sometimes it feels like, oh, Black people are careless, or they don't take things seriously, or they don't follow rules. That's why they're getting sick. But I love how you explained that about the structural racism that has existed, that continues to exist, that actually affects them, then leads to where we are now. I think that's very, very important. And speaking of what you said about bias in the healthcare system, I think it's important that we continue on that subject and chime in, please, when we feel that you should. The numbers that have been affected of the healthcare workers, majority of them that the commissioner of Minnesota reported happened to be African immigrants in the long-term care facilities. Now, you said something very important, that there is bias in the system when they visit, and sometimes when they visit, then because they don't feel comfortable having that primary care service, they use the ER as their primary place because they have to get care when it's really bad. And by that time, it's really bad. So then again, going back to James and your expertise on law, I have heard that they're being forced to go to work where they're unwell. They're being required to show up. I think it's hard being an essential worker that has to provide for themselves and an extended family, but then now that space of like, you must show up. What tips do you have, or what advice would you give?
Well, that's a tough one. And thank you for that tough question. The advice I give is, first and foremost, take care of your health first. So if your health is being jeopardized by coming into a place, I'll use some of the workers in the food plants we've seen around the country, where we had 98% positive tests for COVID. If your health is being compromised, make the informed decision to say no. A job is a job. I know you have to take care of your family, but we want you here for the long run and not getting infected by COVID, which we don't have a cure or vaccine for. So first and foremost, that's the thing I'll say. The other thing is, as Adrienne touched on, we got to demand more testing in our neighborhoods and communities. It's amazing how some government officials, not in the state of Minnesota, but other places I won't name, get tested every day, or they talk about being tested every day, and there are enough tests around the world, where there are not enough tests here in Minnesota. And those tests aren't being set up in communities of color where folks that you talked about are being impacted. So I'd say, as we get more tests that the governor has talked about, the 20,000 tests we want to get daily, we make sure that they're housed in neighborhoods where they're affecting these communities that are disproportionately affected. And not only that, but we have to have partnerships with community health organizations to say, not only Children's Hospital will help you get tested, but other community clinics who have a relationship, who are not as biased and as racist as some of the other healthcare institutions, who can help us partner and make that adjustment as well, is important. So I think that's the second thing, more testing as well. And then the third thing is making sure we share information. Lyna, I want to commend you on this show. A lot of times we don't get enough information. There's a lot of things that are on Facebook that are not true. A lot of things that are on social media that are not true. So we got to make sure we get accurate information, and we have a relationship with Commissioner Malcolm at the Department of Health with Commissioner Lucero, who's the Department of Human Rights, and making sure that we have protections against those being discriminated against because of this disease as well. So it's a tough question to answer. But I think those are important pieces to make sure that we do for those who are asked to and have taken on the mantle of going to work so that we can still continue our economy.
Thank you. Thank you both for saying that. And you gave a lot of tips as far as take care of your health first,
Right.
take care of the body first, so that you can be there to take care of everybody else. Now, I'm going to move on to the next topic about discrimination due to COVID. We've seen and read and heard about, I was just listening to my students share how one of her aunt was assaulted in a Cub Foods right here in the Twin Cities.
Oh,
Someone
wow.
was spitting at them, and they happen to be of Asian descent. So sometimes these things are closer than we think. They are not just in the papers. Then I will talk about, I have read and heard of people saying their family members of Black African descent in China are being kicked out of their homes and being thrown out of hotels by the Chinese because of the COVID-19. We know very well that coronavirus does not discriminate. It doesn't matter who you are, what you look like, what class, how much education you have. But as humans, fear of the unknown, we've seen a lot of discrimination. And then I will take you to another route of those who are immunocompromised and surviving this. But before I touch on that, what is your take? And maybe I should share the governor's helpline for discrimination. So any one of you can go.
Well, I know that I've seen the same stories that you've seen, especially in China, which touched me because my daughter, who is going to be a college junior next year, actually is fluent in Mandarin.
Ah,
And we were planning a trip to China next year,
hmm,
and we have canceled any
hmm,
thoughts of that because we are not comfortable going where our people aren't welcome. And so, and there's prejudice and racism all over the world. We know that. We know that our skin tone is not welcome in many countries. But when it's as bad as it is in China, which is absolutely ridiculous, because we by far did not start this. It didn't start with us. It's not going to end with us, but we are being accused of causing something that has spread across the world.
hmm.
And it's just a very scary time. And so I've had to have conversations with my daughter to say, I know you have Asian friends, and even though you're a black, brown girl, it's up to you to advocate for them. If you are out in public and you see someone being discriminated against, it's not okay for you to walk by. And I am blessed that we haven't seen that here yet, but I do live in the southern suburbs, and we are pretty much hunkered down in a house. We don't go out much, but I know that we'll see it at some point, and I just have to prepare her for what does she do in that when that happens. And
Mhm.
you're never going to be prepared enough, but it's our civic responsibility. Just because they're treating us wrong in China does not make it okay for us to treat people wrong over here or to allow someone else to do it. It is our civic responsibility as human beings to stand up for everyone who is being wronged. And it's hard. It's a hard, story to tell. It's a hard position to take, but that's the position we have to take in order, for things to be not equal, not equitable, but just to be right, you know.
I agree with you that safety first. No matter what, I will cancel and reevaluate that trip. But James, what are your thoughts, especially here in Minnesota when we try to be Minnesota nice, but then you hear about spitting at someone, or
Yeah.
that someone was sprayed or hit in St. Paul the other day, someone was attacked.
Hmm. Yeah, I think it's important to bring it out, and we'll have a whole show about Minnesota Nice at some point about what that is and what it means. But I'd say this: there's a couple things. One is I want to give a shout out to 4 organizations that are doing some great work around this. So one is the Coalition of Asian American Leaders, led by Botal Uribe. Another is the African American Leadership Forum, led by Marcus Owens. Another is the Latino Lead organization, led by Irma Trapiz. And then also Shirley, whose name I can't think of, last name I can't think of, who leads the Taway Foundation. They're doing some collective work on how communities of color can support each other during these times. So one of the examples you gave were some young African American men who did some things that they shouldn't have done to an Asian American person.
In New York, I saw that.
Yep. And rather than us say, hey, you know what, all Black people are this because this happened to this Asian woman, or all Asian people don't believe in receiving Black people because this is the instance happened in China. What they said is, let's collectively work together to make sure that all of us know that we have to support each other and be inclusive and there for each other. So they're actually putting together a statement to come out in the next couple of days around that and saying that we have to be supportive. The song along the same lines as what's happening in Georgia. I think it was Brunswick, where the young man was assassinated by two men on a truck, white men on a truck. And our Asian brothers and sisters need to step up and say, hey, that was wrong too. This thing is not a Chinese virus. It's not an Asian virus. It is COVID-19. It is a virus that can impact anyone, and it was not started by the Chinese in order to impact anybody in other countries. So that ridiculous information needs to be combated with smart knowledge and information as well. The other thing I'll say is, too, we as leaders have to show our young people that we're working together.
Yes.
The best thing they can do is that they see Black people, Asian people, Latino people, Native Americans working collectively together. And then they'll say, oh, okay, we're supposed to work together. I'll even pick on Africans and African Americans, too. A lot of time when I moved up here early on, my friend Hussein Samatar, who's since deceased, but was the first Somali elected public school board official in the country in Minneapolis, we used to have conversations about, why don't we talk to each other as our people? We're from the same diaspora, same place, but we have this animosity that we've allowed structural racism to influence us to not like each other and talk to each other. So I think, to your point, if these communities start talking to each other, start defending each other, start being there for each other, and as we rebuild our economies in these different areas, as we rebuild together, we'll be much, much stronger as well. And I appreciate the governor having the discrimination helpline as well. And as Adrienne said, you got to speak up. If somebody's being treated differently, a friend of mine was in a store maybe 3 weeks ago. He saw an Asian woman being treated differently. He spoke up, stepped in, and that person stopped. So we have to make sure that we're doing those things.
Right. And thank you for saying that. And then I'm going to bring it to the next point, children and Corona. And there was a myth going around, and there's been a lot of myths, especially for the Black communities, that, oh, Corona is not affecting Africans or people of African descent, or it's not going to touch us, until we saw basketball people being affected, and we saw celebrities, and Idris Elba came out, and all these people. And it's nice that they do that for the community, but as a community, we have to stay awake and aware of what's happening around us. And I think, having said that, let's talk about the children. We saw a 5-year-old in Detroit buried about last month, actually, from Corona. And she was 5. And then you hear about all these stories about little children that are affected by lupus and sickle cell, which predominantly affects people that look like me. Our communities, I'm talking about lupus and sickle cell disease. And then I will take it a step further and say there is concern in the healthcare system that the Black people are not getting the testing, or that their symptoms are being dismissed or not taken as seriously. We read about the teacher in New York who went in with shortness of breath, and she was told to go back home. And by the time she was taken back, she was vented and she died. And we've heard a lot of those cases. Actually, those are the few that make it to the news. But we know in our own homes, we've experienced different things in the ER. A friend of mine said that one time she took her child to your children's, James and Adrienne's children's, and the child was complaining of a headache. And I will bring you to this. The child was complaining of a headache, and the ER physicians and nurses did not think anything of it, and they sent them home. Now, they were not even the adequate pain medicine. And Adrienne and I, you understand, when it comes to mild, moderate, and pain, we have different ways of treating that. It can be a simple Tylenol or an IV dose, depending on the severity of pain. Now, this mother and their child were sent home. Incidentally, this became more serious. They had to seek other specialists to make sure it wasn't a stroke, it wasn't a tumor, it wasn't whatever it was. But it would have been addressed initially had somebody listened. So my concern is a study published by the JAMA or the physicians in 2015. It's called the Racial Disparities in Pain Management in Children, especially appendicitis in the ER, concluded that Black children are less likely to receive pain medicine for moderate pain and less likely to receive opioids for severe pain, suggesting that a different threshold for treatment is there. I have two little children. I have used children, thank God that my experience was good. James and Adrienne, you can take that over there. But I think there's also a lot of people that have said that their experience wasn't as good. These parents that I shared their story is real, and their child had to go through a lot of it. Miss Nurse, you can go first, and then the lawyer can go next.
Okay. So I'm going to go all the way back to the beginning of your conversation where the myths about Black people started, because I do want to address that. And I heard it from my friends, and I may have giggled a time or two and said, yeah, when they said that Black people didn't get coronavirus. And so what I have to remind people about is when we first heard about coronavirus and all the data first started being published, it was coming out of China. China is a very homogenous population. Yes, we're over there, but there aren't a lot of us.
No.
And they tend not to report on us. And so it wasn't that Black people weren't getting the disease. We weren't being reported on. And so it was like that all over Europe. When you look at the continent of Africa, the map is changing a little bit, but it kind of looks like the outer ring countries have more cases than the inner ring countries do, and that's not true. It's based on infrastructure.
Mhm.
Those kind of countries have the infrastructure to do the testing, to report the testing. Is the Minister of Health for that country willing to share their data? Because there are countries in Africa where the Minister of Health has said, you know what, we are not reporting any more of our data related to coronavirus.
Mm-hmm.
We can't make them report that data. So it's not that we're not getting coronavirus, it's that we don't know about it. We don't hear about it. The data is not being shared with the world. And so I just want everybody to understand that we get it in larger percentages. It's just not reported.
Mm-hmm.
So that's the one thing. Now for children, the myth was, and it wasn't a myth, it was what we knew about the disease. Because the thing about this disease is I love what my director says is we're learning how to fly the plane as we fly it. Yeah. And that is truly what we're doing with coronavirus. We are trying to treat, cure, and learn about it all at the same time.
Right.
And so when it comes to kids, you know, the early reports were, oh, children don't get coronavirus. So it's really the elderly and blah, blah. And that was true based on the data that we received early on. But as we continue to look at the data and really look at it, we realize children do get coronavirus. They just have a milder form of it. They tend to deal with it better. But they are getting it, and they're getting it in larger numbers here in the U.S. And I can tell you that at Children's, well, not even Children's, the state, the most recent graphs, if you look at the data that's on the Minnesota Department of Health website, the younger people, you know, the young teenagers, 10, 11, 12, from 12 to 20 years old, that age group is starting to surpass the elderly. Mm-hmm. And that is because they, you know, especially with the young adults, they tend to have the attitude, oh, it won't happen to me. I will not get coronavirus. And even if I do, it's going to be a mild form of the disease. I'm not worried about it. I'm going to go hang out with my friends. And I can tell you, honestly, I have to constantly remind my 20-year-old, you are not going to use this opportunity to go and hang out and have all this free time with your friends. And her friends do not get it. Every day she's getting calls from her friends saying, oh, we're having a bonfire, you should come over. Or, oh, we're going to have a pasta dinner, you should come over. And I'm like, what part of you all cannot congregate don't they understand? But young people don't seem to be taking this as seriously as they should. And so that is the problem with why they are getting more disease than was predicted. They may not be quite as ill, but they are still getting it. And the problem with that is then they pass it on to the elderly or their family members who are ill with the comorbidities that we talked about. And so it's just kind of this vicious circle of Yeah, it's all about me, me, me. You know, young people are all about me, 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 and we need to impart on our young people how important it is that they do the social distancing, they do the hand hygiene.
I hear an echo. I don't know whose phone has got an echo. I don't know.
Oh, yes, I hear echo as well.
Maybe it's James. Okay.
We can hear you, but there's an echo.
We can hear you. Can you hear us, James? There's one that is saying that is okay.
That's better.
That's better. But
Yeah.
James, you moved a little bit. Maybe that's what it is. But anyway, thank you for saying that, Miss Adrienne, as James adjusts himself to come back and tell us on what his take is on this. Yes, you did mention the numbers here in Minnesota. Children 0 to age 5, 8%. 6 to 19, 18%. That's 26%, which is actually higher than over 60 population.
Right.
So yes, you're right. And having said that, James, are you able to speak yet, or you're still adjusting?
I think he's still adjusting.
Okay, he's still adjusting. So I will ask you then, Miss Adrienne, you talked about the comorbidities, we've talked about the children, and we've talked about the not assuming that children don't get infected.
Right.
As we go on to share this. And why is it important then for our communities to know that even though businesses are opening, especially barbershops and salons and small shops for clothes that are owned by us, why is it important to think twice about that?
Well, because we're still in the early stages of learning how to treat and deal with the disease. And so the signs and symptoms have changed and morphed so much over the last few months. We really can't determine which sign and symptom is definitely coronavirus. So in the beginning, we were told it was respiratory symptoms. Welcome back, James.
Thank you. Thank you.
So it was all respiratory symptoms. And then it was, if you have shortness of breath or if you have a fever. And now we know that it may be like a smell and like a taste. And so we've had people that had no symptoms at all, had a very low grade fever of maybe 100.8 or 100.1, tested them and they tested positive for COVID. And so if we have people that don't have symptoms that are walking around with COVID, and we all congregate in the barbershop or in the beauty shop or, at the grocery store without our PPE and without doing our hand hygiene, well, now we're spreading it throughout our community. And again, it's a vicious cycle. So maybe you have a mild form of it and that's why you're asymptomatic, but then you spread it to your newborn or the grandmother of your newborn or your elderly neighbor, and so it's like I said, it's a vicious circle. And so we have to be really mindful about, it's not really just about us, it's about us, everyone around us.
Yes.
And that's what I tell people, because somebody said, well, if I'm in my backyard, I don't need a mask. No, you don't. But if you leave your backyard and you're going to be around people, then you need one. Right. It's not the environment that's the issue. It's the people in the environment.
Yes. Yes.
And so we need to be protecting ourselves from people. For instance, I had a little cabin yesterday, and my girlfriend insisted that I come and see her. It was the most ridiculous thing in the world, but we had the best time sitting in her backyard about 10 feet apart. But that was better than, and we FaceTime and we, do all of that, but we just needed to be in the same space with each other. And I told her, I said, well, I'm not coming to your house, but I'll sit in your backyard with you. But it was the most fun thing, to do, because we have to get some sense of normalcy. I get that. We still have to be careful. You still have to be careful. She has a son that has chronic asthma. If I was walking around with asymptomatic coronavirus and I gave it to her son who has chronic asthma, and for some reason he did not do well with coronavirus, I would never be able to forgive myself.
I agree. And since you brought that up, I'm going to bring James back for two things before we conclude. Thank you for saying that. And I know the only reason I'm going back to that before we finish is that James has a daughter who's got sickle cell disease, and we can talk about the pain in the ER. We can talk about this, but I think to address coronavirus specifically and immunocompromised people, it's that I was talking to a friend who's had cancer for most of her life and lupus, and this is the life they've had to live of social distancing and a mask. So this is not new normal for them. That's their normal. So I think for James, what would you like to say quickly, and then I will have you guys close with the leadership nuggets.
Sure. Just real quick, I do want to say thank you for getting me back on. Is the discrimination that happens, as you talked about, coming into a hospital environment about the pain medication and around COVID. If you're being treated that way, you may not want to come in to get checked for COVID because you're afraid you're going to be treated in a discriminatory manner or a manner that's saying that you don't have that pain that others have. I'll say this, 1619 is an important year in this country. I'm not going to explain to anybody on this call about when it is or what it is. Just look up Jamestown in 1619 and how Africans were treated from day one when they arrived here forcibly, treated as mules, treated as people who could take whips and chains, and treated as people who were physically able to accommodate more pain than others. So you transform that forward where you talk about healthcare. It makes sense that people would think, white people in particularly, oh, they take more pain than anybody else can, or they can have childbirth and they don't need that much medication, or sickle cell disease, it may be a 10 to her, but you know what, she can endure that pain a little bit better than others. So that ignorance comes from a place of 400 years of developing that nonsense, and then that nonsense leads to some of the bias that happens. We have to get rid of it. We have to educate people on why they're doing it. We have to let them know that some of it's explicit, but some of it's implicit. And we do it sometimes to ourselves. Like, you know what? When I was a kid growing up, my dad used to be like, oh, that's a little bit of pain. You're good. Don't worry about that. Like, my dad is broken. It hurts. Those are things that we're taught sometimes as a community to suppress our pain, to suppress our emotions, to suppress our tears. So we have to address that as well. And then the last thing I'll say, Lyna, on that before we get to the leadership piece is, as Adrienne talked about, we got to make sure we continue to educate our people on what's, I call it physical distancing, not social distancing, because I need my people. I need to be around people. Today, I safely went out and played physically distant golf with about 20 other Black men who are in this golf league with me. And the reason I bring that up is this. Last 3 weeks ago, I was like, nope, I'm not doing that. It's just not safe. I made to make sure that I get out and connect to them from an emotional standpoint, to see them. We played a nice round of golf. We didn't touch. We wore our masks when we needed to. Those are things that are important to do and let people know that you care about them and you love them. And as we been talking about going over her friend's house, she did it. They were socially distant and physically distant, but they were still connected as well. So one last thing, I want to give a shout out to Tawana Black, who let me know that the Lincoln Leaders is the program that I talked about earlier with Latino Lead, ALF, Coalition of Asian American Leaders, and Tuwai Foundation. It's called the Lincoln Leaders program.
Okay, thank you. Thank you for saying that. And I think with that, unless there's something you can add, so the key thing that I'm taking away is that we need to educate ourselves and how the bias started and what we can do about it. So the bias that we see with pain management or treating Black people as subhuman started from somewhere, and it's up to you and I to change and look at it differently or address that. Having said that, I love leadership nuggets, and with COVID, even though we are going through the same pandemic differently, our job is to make sure that we are protecting ourselves and protecting those around us, and really this is a problem for everybody. So when leaders see the value of diversity, then it will not be a workshop or a training to check off on their education piece or a CEU or a required education. They will actually work to include diversity and actually have inclusion reflected in their hiring, their retention, and the progression as providing resources for those people of color that they bring into their company. A survey from 2015 by the American Hospitals Association reflects that it's called the Diversity in Healthcare Management. It found that while minorities represented 32% of the patients in hospitals, they comprised only of 14% of hospital board members, 11% of executive leadership, and 19% of mid-level and first-level managers. I should really put that up. And then on gender, despite a healthcare workforce that is 80% female, women occupy approximately 25% of hospital CEO positions. So 75% are men, even though majority of the people are women. And representation of women of color in that 25% is in single digits. And when I looked up at the CEOs of America, it's actually not, we're not there. We're not even in the boardrooms. So that I would want James to address it.
So, good question, tough question. We first of all have to own the data. So at Children's, we're 55% patients and families of color and Native American families. We are only 12% of the leadership positions held by people of color and Native Americans. And that rose from 9% when I first started last year. So we've gone up, we need to go higher.
Wow.
So we need to be intentional about saying we're going to do that. We have to do that with intentional recruiting. 3 of the 4 last positions we hired were people of color, men of color in particular, and we got to do better with women of color as well, because we were intentional about where we went to look for candidates. We were intentional about who we wanted to bring in, and if we got a slate of candidates that wasn't that diverse, we said, let's try again, executive recruiting firm, because we have to do better at getting more candidates in to discuss that as well. The other thing that you mentioned about board of directors, we changed our board of directors selection process on our foundation board and also our governance board to make sure that we're intentionally recruiting for diversity. And not just to put a face and a name there and say you got that 1 or 2 people of color, but to know authentically engage with them and their communities as you get on the board and have a different lens. The other thing I'll say too, Lyna, and this was a one we did that not a lot of hospitals did, a lot of furloughs and layoffs have had to happen because of COVID and the economic impact. What we did was applied, our CEO said, let's apply an equity lens to that to make sure we're not disproportionately impacting communities of color, Native American communities. So we put together a 1-pager that talked about bias. We looked at the data to make sure that after our furloughs and layoffs, it wasn't disproportionately impacting certain communities of color and not others. And that's something that you got to do. As organizations develop in this space, you got to make sure that it's woven into everything that you do. It's not just the hiring thing or retention thing, it's how we make decisions. And the last thing I'll say about that is when this comes back and we get more money in our coffers and we're able to go back to doing business as we were before, we got to make sure we're investing in women-owned and minority-owned businesses. They have suffered the most because they're the smallest. Our businesses don't have but 1 or 2 people employed sometimes. So we have to intentionally say, Children's Minnesota, we sit in the Phillips neighborhood, we're going to go invest in Native American, Latino-owned, and African-American businesses within a stone's throw of our door because we want them to survive. So that's a long answer to your question, but that's how we get to a different place. Another thing is report out on data. Other hospital systems should do what I just did. Tell us where you are with respect to leadership, people of color. Tell us where you are with respect to women. And if you're not there yet, cool, we're going to help you get there. But a lot of people don't do that. They don't have that transparency.
Yes. Miss Adrienne, do you want to say something?
Yes, I just want to say I'm very excited to have James at Children's. I have been fighting the good fight for 20 odd years without much success. And so I am just very excited to be working for and with him. He's made some really big changes, and I'm one of the leaders of the Black Employee Network, which is our employee resource group at Children's. And we are already seeing changes. I mean, he's only been there a year, but we are seeing some really positive changes. And so just for people to know that change is possible, but you do have to step out on faith. You have to be okay with being uncomfortable, which we always tell our allies, but we also have to be okay with being uncomfortable. We have to be okay with making other people uncomfortable. You know, we can't always provide a safe space for others. Sometimes we have to provide a space that works better for everybody, which makes others uncomfortable. And that's okay. You know, but yes, so exciting things coming, and it is getting better.
I like that. So even in this season, I just want to allow my guests to say one final word. And as they do, I think all our viewers, I want to thank you. I want to thank Miss Valentine, everybody that commented, Christy, everybody that has been throwing up comments. I've been trying to pin the ones I can. Thank you all for watching. And in Africa, there's a great African proverb. You know, I love to share that wisdom because it's very important. That when I look at the racial disparities as an elephant, when you have to eat an elephant that is in your way to get somewhere, you have to cut it up in small pieces so you can finish it because you can't take a bite of it. It's a big animal, it's bigger than houses. So I think for our communities, the companies out there, they should look at their situation as part of their daily takings, daily undertakings, not as a check off somewhere. Because I think once I heard somebody said that addressing diversity in our companies, like they got a bigger fish to fry. They don't have to dwell on that. But I think it's important that we bring leaders such as yourselves who are bold and creating that huge influence and impact in your spaces, because it's not a joke. And especially in healthcare, I've been a nurse for almost 20 years. I know that it takes work and it takes effort. So I want to thank you. But on your final piece, Ms. Adrienne, you can go, and then James, and then we'll wind up. And thank you, everybody.
Yep. So, what I always tell people is look for leadership opportunities in unconventional places. And a leadership role is not necessarily a title. And so, even though I am not a manager and I'm not or a director at my hospital, I am still a leader. I am considered a leader. My CEO knows me by my first name. He recognizes me. We have conversations, and he actually refers people to me when they go to him with questions. And so, build yourself as a leader in any arena. For instance, being the president of my local professional organization, I never thought I would do that, but I started out as the conference chair, and then I was a liaison for vendors, and then I was on a couple of committees, and then I thought, well, why don't I run for president? And so, as in doing that, the organization also, it kind of opened their eyes, and they said, "Oh, she's the president," which to me wasn't a big deal, but to them it was. And so, that kind of helped build me as a leader personally, but also professionally. And so, just look for those opportunities wherever you can get them. Don't shy away from anything. Find a good mentor. Mentors are wonderful. And if anybody needs a mentor, is looking for assistance, I am available. I am more than happy to work with people. I have a couple of nurses at my hospital because I'm good for pushing people into leadership roles. I'm trying to get better about putting myself in them, but I see leaders in everybody that I meet. And so I am more than happy to help people to talk to you. We can meet for coffee or tea or whatever, go for a social distancing walk and talk about it. But I am available to help people if they so deem that they need it.
Mm-hmm. All right. James,
and I'd say, thank you. I'd say we need to invest in future leaders. So one of the things that I make sure that I do is I mentor as many people as I can to have them have access to leadership roles. As Adrienne said, it's not about a title. It's about making sure that you can get good work done and get visible, become visible as well. So that's one thing. The other thing I'll say to companies, in particular in Minnesota, you have to invest in this work. You can't, I want to say a big shout out to Children's that I don't not only have me, but I have 5 other staff members that we've invested in equity and inclusion, in addition to having a voice at the board of directors meeting, at the foundation board, and also amongst our executive team. A lot of my colleagues in other hospital systems don't have that. They don't have that investment. They don't have me, and they don't have a serious person other than talking about checking a box about some training. Yes. So we got to do better in that sense and demand that as well. And then the last thing I'll say is, as we move forward, we have to realize that this COVID-19 impact, as deadly as it is and as tragic as this disease is an opportunity for us to say, how are we going to come back from this in our communities by investing in businesses, investing in employment, and ending these health disparities that we talked about. There's no reason that we should have disparities in asthma, high blood pressure, diabetes. There's not a physiological condition that Black people have that others have. There's a social constructs that we can determine and change by which to make that. So I say investing in that as a state is important. And the last thing is supporting shows like yours, Lyna. This is an amazing show, an amazing opportunity. I would love to get more people I know to listen to it and come on and be a part of it. spreading this information to the community is very important as well. So thank you.
Thank you. Thank you both. And thank God for this opportunity to share to the world and get seen. The people awake in Kenya, I am shocked. Thank you, my girlfriend, my schoolmate from Australia. Oh my goodness. Thank you guys for being with us. Everybody from Minnesota to Georgia to Detroit. My friend Eddie, my aunt Pam from Detroit, I see you. Thank you for watching. So having said that, I want to say next time we can do this again. People, don't forget, wear a mask. It makes such a big difference to protect yourself out there. So when you come home, you're not bringing things to your loved ones. Make sure you're washing your hands. That's old school, 20 seconds. We've done that as nurses for 100 years from Florence Nightingale. We need to continue that. And for the people that I know that it's rough, you want to get out, but as hard as that is, try to stay in, because this is not, I always say that social distancing is not a luxury. It's a treatment. It's not supposed to feel good. So you must do what is needed to make sure that we are all staying safe. Yeah. Thank you both. God bless you. Till next time.
Thank you.
Thank you. Good night.
Good night.